Let's go to Ian Froese of CBC with a question about healthcare. Ian.
Thank you, Mary Agnes. Let's get right into it. Mrs. Stephenson, under your government, we still have some people waiting years for surgeries. Some staff have left, others are exhausted, and wait times in some hospitals are double what they were before the overhaul to the healthcare system. Why should voters trust you to fix healthcare this time?
So when it comes to healthcare, again, health human resources is the number one issue that we're faced with out there. And this is nothing unique to Manitoba. We've faced it right across the country. We've had these discussions at the Council of Federation table, the premiers from right across the country, and what the challenges are. And we were able to band together and come together when I was chair of the Council of Federation to get more money from Ottawa to be part of the solution of this as well. But again, we have invested more than $400 million into the health human resources side of things. Recruitment, retention, training of healthcare professionals. We've reached our 2,000 goal by the end of August this year, but we're still going. We're still recruiting. 300 more nurses from the Philippines that are coming to Manitoba. This is very exciting for our province. And I can say that this is already going towards tackling the surgical backlogs that came as a result of COVID-19. In fact, we have already reached where we need to be in terms of getting back to pre-COVID when it comes to our surgeries, and we're surpassing it.
You were just asked about that decision to convert 3 ER departments into urgent care centers. Looking back, would you have done anything differently? And what would you do to remedy the situation?
Well, I think what Mr. Canoe wants to do is take us back to when we had the longest ER wait times in the country under the previous NDP government. And that wasn't after a pandemic. So I would say to Mr. Canoe that is taking us back in time. We need to move forward in healing our healthcare system.
We'll segue to Mr. Canoe there. You made that promise to reopen 3 ERs in Winnipeg. Some working in healthcare, though, say it's unrealistic because a lot of staff are needed for those ERs and for all the beds you need to support those critically ill patients. Specifically, how many staff would these hospitals need, and where would they come from?
Well, I'm so glad that you asked this question because you're articulating our plan right along with us. We know that in order to restore emergency services, it has to start with the staff. Anything we want to do in healthcare for the future of Manitoba has to start with staff. So 300 more nurses over the next 2 years, that puts us in a position to be able to break ground on a new emergency room for Victoria. And then we proceed in sequence with the others that we've announced, including Eriksdale in rural Manitoba. But we know that we're not going to get the change that we need with the same government. We can't just throw more money at the existing approach to healthcare and expect that we're going to get the results that we need. What we need is a new approach. That's what our team is bringing. And chief among the innovations that we want to bring is a new culture in healthcare. More focus on the front lines, more focus on the nurse and the aide who's serving you, and less with the bureaucracy that has flourished under the PCs. So we want to de-emphasize and simplify the bureaucracy and focus on you, the patient. This will be difficult work. I fully acknowledge that. But the way we do difficult things in Manitoba is by doing them together.
Mr. Canoe, though, where will you find these staff? Provinces throughout the country, everywhere is struggling with a staffing shortage.
Well, we've got to get into the game. Right now, other provinces are poaching our talent. So we have to have a competitive offer. We have to have better working conditions, more work-life balance, but we have to implement that better culture. So we can recruit from other provinces, we can train and develop from within, and we have retired nurses and retired aides here in the province who are willing to come back if we would offer them improved working conditions, including those working at nursing agencies. So we're going to make the right investments, we're going to make the right changes in culture so that we will be able to make healthcare work for you.
Mr. Lamont, one of your promises is to give bonuses of between $5,000 and $10,000 to all frontline healthcare workers, including those who return to the public system.
Yes.
What evidence do you have that would entice the hundreds more healthcare workers Manitoba needs?
Well, look, it was because Rhonda Nicol, who's a nurse who recently retired, told me, he said, that's the figure, and talked to a bunch of her nursing colleagues who said, that's the figure that would help people get back. It's based on a plan out of Nova Scotia. So we would be saying, this is absolutely critical. And I'll just say, the promises about ERs are so leading. One of the things that's really, really important to us is to be honest with Manitobans and not give people false hope. This is not a time for false hope, and I think that's what the NDP are doing. But we know that there are thousands of people in the healthcare system who haven't had bonuses, who are still waiting on bonuses and are backlogged and have been, they were essential workers during the pandemic and they weren't well treated and they weren't well paid. So part of this is a thank you bonus and then a retention bonus to ask, $10,000 for a nurse to come back for 2 years. Because we still actually have lots of nurses in Manitoba, but they've all moved into private because they can actually have a work-life balance, which they can't in the public system. So it's all about replenishing that public system, rebuilding our public system through training. We have to expand our training at the University of Manitoba, which is part of our plan. We said we should build an entirely new faculty for rural and northern family medicine in Brandon, so that we need to massively expand the number of people we're training, because for 30 years, the other two parties choked off the amount of people we can actually train in Manitoba.
You were shaking your head though at Mr. Canoe. How many ERs do you think Winnipeg needs?
Well, look, I'll make the point that this was an NDP plan in the first place, that Brian Pallister pulled it off a shelf and said, well, look at this. The NDP are planning on shutting down a whole bunch of ERs. And they had completely neglected those other hospitals in the first place. What we need is, I actually think we should consider building mini hospitals.
Can I just jump in?
No.
Because I've been invoked.
I would like
You
to
got a
finish.
sec. You have a chance in a sec.
Okay.
Go ahead, Mr. Lamont, quickly.
No, simply to say we need 3, but we need to be focusing not on building crisis centers, but on keeping people out of ERs by providing care in the community. And that's not happening.
Thank you.
I'll stop you there.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.